Hi, I'm Jessie, dietitian at Adjust Coomera. Stick around to the end, guys. I'm going to give you the 3 common mistakes that women who have just been diagnosed with gestational diabetes tend to make. So the reason I'm talking about this is because gestational diabetes can have serious health effects for both the mother and the baby. So having high blood sugar levels during your pregnancy can actually increase your blood pressure, and that can lead to things like preeclampsia, and it can also lead to excessive birth weight of your baby, as well as potentially an early or preterm birth as well. So we definitely don't want these things for you. And so what I do is I help you and teach you how to make healthy choices and eat well, so that you can keep your blood sugar levels lower, and we can decrease the risk of excessive birth weight, and we can also make sure that you carry your baby to full term. So the top 3 mistakes that are made when women are diagnosed with gestational diabetes. So the first one is starving yourself. So this is really not appropriate, but what happens is you think, oh, well, if I eat anything, it's going to put my blood sugar levels up, and that's going to increase or potentially harm your baby. So what women tend to do is go, okay, I'm just not going to eat anything because I don't know what's good. But that's also going to starve your baby of nutrients, and yourself as well. And both of you need that nutrition to make sure that you're staying healthy, you've got enough energy, and also so that your baby's growing. So the second mistake that mothers tend to make is that they don't test their blood sugars because they may be afraid of the pricking, or you have to do it so often and you think, oh, is it even worth it? The thing that testing blood sugars helps with is for us to monitor how you're actually going with your sugar levels, and so that I can make adjustments if need be in your eating. And if you're really worried about pricking 4 times a day, which they generally do recommend, at least get the first one done in the morning, so your fasting sugars. If you're not going to test any other ones during the day, just check that morning one before you eat something. That gives us a really good idea of what's going on, and then you don't have to worry the rest of the day. The third mistake that women tend to make is actually eating low fat. So typically this is a recommended healthy dietary change that we make, is to eat low fat. But what happens is when we take the fat out of foods, they actually get a bit boring and they taste a bit like cardboard. So the next thing we go for is sugar to add a bit of flavour. And what that's going to do is increase your blood sugars, and we're trying not to do that. So we still want to include fats. We just want to make sure that we're including those healthy fats. So we want to try and still limit saturated fats. But what fats are really good for is also keeping us full. And they also help actually stabilize your blood sugar. So when you have a bit of fat in with your carbohydrates or sugar, it actually slows down the digestion of that, which means that your blood sugar levels don't increase as quickly. So this is a little bit of a controversial thing because we are generally recommended to have low fat. It's just making sure you're choosing the right fats to help stabilize your sugars and to make sure you're not going for those high sugar foods. So I see lots of women who are going through the same thing. They've just been diagnosed with gestational diabetes, and they're worried and stressed and not sure what they're eating. So I've helped a lot of women go through these 3 common mistakes, and we've gotten some really good results, and they've been able to carry their pregnancy through to full term, and their baby's been born at a really good weight. So thanks for watching, guys. If you do want some more details, please click the link below and head to our website, or if you do have any questions, comment below or send us a direct message and I'll get back to you personally. Bye.